it's kind of like holding space for the body, but not really like pushing like, oh, you must heal here. This one needs 10 gram of calcium and 20 gram of iron, and like just come here. No, we are not demanding that of the body. Like if that's the priority of the body to devote more resources to heal, then that's where it will be. And that's pretty much what the whole I mean, that's my experience of it.
Hi, and welcome to another episode of Shift with Shubhra. I'm your host, Shubhra Benetti, and I am a sleep consultant for adults and children. I'm also a baby science program instructor, and I'm also a Akashic light healing practitioner. And on today's episode, we will be talking about craniosacral therapy. Now, craniosacral therapy is one of those body work therapies that is probably not the easiest to probably explain unless you've gone through the therapy modality itself. And today we have Sharon Tan, who is going to talk about craniosacral therapy because she is one of the locally trained therapists in Singapore. Sharon began her journey through actually setting up a photography school initially, and then she later closed that down to then pursue her passion in the healing modality arts. We should say probably arts, but it's an art of its own. But basically, she went to pursue a passion in the healing modalities. So, after suffering from postnatal depression, her cousin basically offered to do emotional freedom techniques on her, which is also known as tapping. And she was able to beat the depression without the medication. So she went on to learn EFT, the emotional freedom technique, and and matrix reimprinting to help her cope with some daily stress. But eventually, she started having some back pain. And even upon seeing a physiotherapist, she wasn't able to release the back pain itself. So she was introduced to see a craniosacral therapist, and the craniosacral therapist helped to reboot her system. And it was from that therapy session that she gained a very keen interest in craniosacral therapy and then began to train and complete her trainings in it. So she is taking courses on craniosacral therapy as well as somato emotional release so that she could determine the root cause for where this pain was stemming from. And her niche and her interest has always been about chronic pains that arise from possibly childhood and emotional trauma. Sharon tends to look at the human body as a whole system, meaning that she looks at the emotional and mental states that basically affect the physical well being of the person. Pain is not our enemy, is her philosophy. It is our friend because it has one job, and its job is to send a message to our body um, into looking for what it craves for us to know. Essentially, that's the philosophy that she operates. So basically, pain in your body is trying to send a signal or send a message to you about what it's craving for, and she chooses her vocation to find out what it is, to help you discover it so that you may attend to it and then release the physical manifestation of the pain. So by tuning into our body, we'll learn a little bit more about how to release the physical pains that have manifested. And I am very excited for you to meet Sharon and for tuning into this episode. If you have ideas for future episodes, please do write into us. And if you like the content of today's episode, please like, share, subscribe to our channel, press the little bell button for updates on latest releases of episodes. We drop a new episode every Monday on YouTube and our subsequent streaming platforms. The audio are also dropped around the same day on Mondays. So please do subscribe and share this episode with anyone you think that might benefit from the content. And I hope you enjoy today's episode. Thank you so much for tuning in. We can just go into that. What is your journey? Let's go into it.
Okay. So I had postnatal depression, and then I also had like tons of like back pain, recurring back pain. So like the postnatal depression really got me exposed to my first modality, which is emotional freedom technique with like
Is it the
tapping.
tapping? Yeah.
Yes, yes. So using that to help calm myself down. So it actually helped my depression without me taking medication.
Oh,
And
wow. Nice.
it really blew my mind. So yeah, it got me into this journey of like exploring alternative therapies. And then eventually I saw this is a separate thing. Like my emotional health was like okay, managing, and then I had a physiotherapy for my recurring back pain, and it was always coming back, the same issue, like no matter
Right.
what exercises I do at home, or I try to go for a walk or yoga to stretch, nothing helped. So she suggested I try craniosacral therapy, and at that time I was like, what is that?
Yeah.
And yeah, I think for 1 year she tried to convince me to go. So eventually I went, and the first session there I just fell asleep.
Right.
And so I mean it is a hard modality to explain and
Yes.
pronounce. So it's like um so that's what she said, like oh, you go there and just reboot your system because your body is so like tense, and like all the habits are all in this place that is not budging, like no matter what I do and no matter what you try to do, it's not moving. So then I went to see the cranial lady, and then yeah, I fell asleep, really deep sleep, and it's not something I'm used to. I mean, like having a baby for the
Yeah.
first 2 years, you hardly get much like sleep or deep sleep, right? So it really helped that having that pocket of time to rest. And then eventually one day she told me, oh, I'm sensing you have some emotions trapped in your intestine. And I'm like, what?
Yeah.
So so then okay, she said, okay, yeah, my mentor is coming to town, would you like to try? So I didn't really want to because she was quite costly, coming from New Zealand and with all that fees. But I forgot what was it that made me like realize, okay, I think I need to see this lady. I think I had kind of like a near meltdown one
Right.
day.
Right.
I can't remember the reason, but anyway, so I decided to go, and then I went. And for that whole hour on the massage table, I was just shaking a lot. Like I had a lot of pins and needles in my body, like in places I have never felt before. Usually we get
Right.
pins and needles in our limbs, right? But I had it like in my nostril, my lips, my earlobes, like eyelids. It's really very shocking for me. But at the same time, it was very cathartic as well. Like I
Yeah.
explored some of my traumatic childhood memories, and then but together with Cranio, she actually used that technique to like calm myself down. So I actually felt safe to explore some of these memories. And at the end of the session, my whole abdomen was so soft, and I was like in shock. I was standing there in the toilet for like I think a good 10-15 minutes. I just, oh my god, what's that? How come my abdomen is so soft? Because every time I went for massage, they always say, do you have like a growth in your abdomen or something? Why is it so hard? Like usually
Wow.
people has very
Yeah.
soft middle, right? And I know it's fat. I mean, I just gave birth. There's a lot of loose skin, but why is it still so hard? But yeah, so it was a very
Like
huge,
unconsciously that your muscles were tense and you didn't
yeah.
know why. Yeah. Okay.
Yeah, so I think that open like the door wide open for me to like, oh, look at this. There's another way in to access emotions in a way that is safe for the body to feel safe and calm, and then after that, like all the physiotherapy and all this, it started progressing again. So I felt like it kind of unlocked and changed some neural program in me that now I'm open to change. Now I don't have to keep holding all the tension and refusing to let go. So that was pretty much like how my journey has been.
So then what if you could break down what is craniosacral, because cranial obviously means cranium, like the brain
The
or
head.
the head, and then sacral being the lower part of the spine where the sacrum
Sacrum
is.
is, yes.
Yeah, which is where for people who don't know where sacrum is, it's basically where your pelvis, your hips sort of at the back go together,
Yeah,
and then your
that
sacrum is sitting at the
triangle.
back. that triangle part. So can you
Um,
explain what it is? Because obviously it has something to do with the head and the sacrum, but
yeah, so it's literally head to toe of the
mm,
spine. Well, craniosacrum, like you say, is like the head bone and then the like the tailbone where it is, and it's actually the whole nervous system, the physical hardware of that nervous system. And for us, what we do is actually we access what we call the craniosacral system,
okay.
which actually, to put it really simply, is how our brain, it produces fluid, and then it travels down the spinal cord, and then it goes down, and then it provides nutrients and information into the nerve, sending messages and all that. So that fluid, so it goes from the head all the way down, and then it goes up again. So as it goes this way, the body actually has certain moving patterns, which
Okay.
which creates this rhythm. So this rhythm is different from our breathing rhythm, from our heart rhythm.
Okay.
Yeah. So this is what we sense. And in craniosacral therapy, we sense the balance, the symmetry, the whole quality of that rhythm in a person's body. And then we see where there might be some tension stuck in the body. We usually call this a restriction. And then we will go there and gently put our hands over the area, kind of telling the body, the brain, like, hey, this is an area of restriction. Can you please send your whatever you need for recovery, nutrients, nerves, some support here while I'm here. I'm here observing, and I'm here to support you. So then the body starts doing the healing on its own. Yeah.
Okay. So
So
it's a little bit it's a bit physical, but it's a little bit esoteric because we're talking about it kind of
energy,
feels like energy. Yeah, we're talking about energy a
right?
lot more than, I mean, we're talking about physical because obviously, for example, if someone's having tension, like you, in your case, right, or when I came to see you, I had physical tension in this part of my body, or you had it in your back, and then I had it in the upper
Yeah.
thoracic, sort of like
Yes.
middle back. So it starts with locating the pain, right, on the physical
Mm.
sense, and
Yes.
then when you sense, you're sensing with your you're
Hence.
sensing with your hands, but you're sensing it with your senses.
Yes.
In a way, like in the sense of like you're sensing the energy, like if it's a strong energy or light energy or some sort of, are you is that what you're sensing? Because I'm trying to, because if people
Mm,
don't even understand, if people may not understand sensing, right?
mm, mm.
What how does that how can we explain it to them?
Okay. So if let's say we just close our eyes and then we just breathe, and we can sense like the ribs opening, right? Like how our body moves.
Yeah.
So that's sensing. That's just one way of sensing, that we are sensing a physical movement. Then
Yeah.
we have five senses. We have the smell, we have the touch. So for me, when I put my hands over there, I'm really sensing like not just the rhythm, but also whether there's heat given off in that area, because it's a sign of release of that tension there. Yeah. So it can be very physical. It can also go like esoteric, like you said, because I mean, we are all energy, right? And sometimes I kind of explain this to my clients, like how we actually store emotions in our body, or we
Yeah.
store certain energy in our body. Because I mean, when you're angry, this is what you do, right? You clench your jaw. If you're stressed, you always go this way. And when you're working and you're always doing this, and over time, people say, yes, I'm starting to get wrinkles
Nice.
here.
Yeah.
But why? Because the muscles here are like tightening, right? So over time, the body forgot how to relax this area. We forgot how to relax our jaw. We forgot how to unclench our hands. So when we sleep like this, and when we wake up like this. And then we go like, hey, Sharon, I cannot sleep well at night. And I'll be like, why? I'm always having this pain, that pain, and I cannot sleep well. Well, that's because you sleep like this, right? So this is how we store tension, how we store energy, how we store emotions in our body, like physically.
Yeah.
And my job is to actually go in And I always like to use the physio's word to reboot the system, kind of reteaching the body like, hey, it's okay to rest, it's okay to relax now, because we always have a cycle, like, if we want to work, we are activated, but if we need to deactivate when we rest. And people with chronic stress, they're always like this, right? They cannot really rest. Their body can no longer go like, okay, let's shut down. So some of them, when they sleep, they jerk awake like in the middle of the night,
Yeah.
or they just don't go into that very, very deep sleep. Yeah.
Yeah, that's right. So in a sleep side of things is that if you are tensing muscles, right, the brain is obviously having to send a signal to a muscle to tense. So if it's sending signals there, it can't actually, because you need to go into a much more relaxed state of muscles to go into deep sleep, so that your brain is not telling a muscle, oh, you need to hold on or you need to relax. It can focus on just going into deep sleep and not actually tell a muscle because you need to tense. And of course there's different systems, like we're talking about different minerals that are affecting it, right? So calcium, calcium will, amongst a lot of things, it tenses your muscles. Magnesium will basically do the relaxing, so it balances each other that way. But and of course, for a lot of people, a lot of the anxiety also sits in their jaw, because they're clenching their teeth when they're sleeping, so then their entire face is going like this, because they're so, oh, I need to do that, and then I need to do that, and then I have to do that, and when I have to do this, and I'm going to have to do
And
so
they
many things.
just cannot shut down.
They can't shut down. So if the brain is focusing on tensing here and pushing all those thoughts, then on the sleep side, you're not going to be
And
sleeping.
there's also the other way, like we think that the brain controls everything. Like, okay, now my brain is happy, so I'm smiling. Actually, the other way around is it works too. Like how, sometimes if you read like some personal development, they say, okay, if you smile, you're actually tricking your brain to think that you're happy, and then you actually alter your inner state that way. And I see it more often for like when we are in this very tense state, right? Actually, we are not feeling tense now, but because physically we are doing this, it sends the signal to the brain like, hey, I'm tensing up. So the brain gets ready, and then the anxiety comes. So it's a vicious loop, like it's always never ending. The body is always on alert.
Yeah.
And then we get burnout, we get chronic pain, we get like diseases happening. And end of the day, it's all because we forgot how to relax.
Yeah, absolutely. Maybe we can then talk about who can use, obviously, because you talk about rebooting the system. What can craniosacral help with? I'm sure there's a very long list, but can you just name I mean, obviously name the ones that you probably work with, because you work with because I mean, reading your profile as well, that you like to focus on physical pain that has probably manifested from emotional trauma. And I think on one side we need to obviously talk about that, like how does that work, but maybe first let's talk about all the different ways that craniosacral has helped people, so that people know, oh, if I have this, then maybe I can consider seeing someone.
I will say for myself, I have seen mostly people with chronic pain, and some of them have like autoimmune disease, like some connective tissue disorder, and then people with PCOS, people with fibromyalgia, endometriosis, a lot of like female gynecological issues. And then I also have like tinnitus is another common one. For tinnitus, it's very mixed results. So because the cause is unknown, there's no cure for it. And there are people, like there's a huge group of people in UK who has seen like really good results with CST, but then there are also people who have not. So I am helping a few people with that. And I'm still, in my very small sample pool, I'm still waiting to see how it works out for them. And then I have also seen a few babies with tongue ties. And sadly, I mean, because the parents didn't know about CST before they went for the snip, so they actually cut off the tongue tie. But I mean, I'm glad that at least, they enlisted the help of CST to help the baby's rehabilitation at the end of the surgery. So what it does is actually it can help relax the muscles, the facial nerves, and all that in the mouth, so that the baby can develop better, like maybe suckling motion and all this. I mean, I feel like at least help the baby do this and achieve these milestones before looking at surgical alternatives. Of course, there are the users of that, but I always hope that instead of CST being the last resort, how about surgery is the last resort? But I mean, this is a very personal opinion, of course.
Yeah.
Yeah, and some of them with migraines, like really huge migraines or TMJ, the jaw pain. I have one really amazing, like I'm mind blown myself. She saw me one time, but she's someone she has done a lot of work on herself. So she had TMJ issue, and she said she has been having this pain in the jaw for the past 10 years and always have to resort to Botox to numb the nerves in that area. If not, she cannot eat, she cannot talk.
Wow.
And it was an emotional thing. So she released like years of being suppressed in terms of like expressing herself as a girl, being looked down upon by her family. They're very traditional Chinese family who just believes strongly that girls are seen not to be heard and you cannot be successful. So she has to do a lot of work to push past that. And during that one session, she was okay. Like 3 days later, the pain went away, everything was fine. So I was mind blown. Like actually, that was what her body needed to express.
Yeah. Right.
And,
okay.
Yeah, I mean, like the list can go on, but these are some of the issues that I have seen so far, and very honored to be part of their journeys.
Yeah, and I think that's the thing is that what you also covered is that it's not limited to an age, right? It's not limited to you can work with babies, you can work with adults, you can work with pregnant women, because it's that gentle of a modality.
Yes.
That it's non-invasive in a sense. It's not like you're putting your fingers in someone else's, I don't know, nostrils or ears or something. But it's just literally like you're just touching. It's almost. Would you say it's almost similar to Reiki if people have heard of Reiki because you are touching the body?
This is one of the common questions I get. From the outside, it looks like Reiki.
Yeah.
And I mean, it's just placing hands on top of the body, but no one can really see what's happening in the body, right? So for Reiki, I have received Reiki before, and from what I understood, it was the Reiki master being the conduit for the universal energy to come through and then enters the patient's body to help with healing. For me, I am not a conduit for any energy. I'm not giving energy to the body. I am just there to facilitate the healing that happens within the client's body by the client's natural healing ability. Yeah.
So you're not even because I think, yes, if people have, because I will be talking about Reiki at some point on this podcast, and I will be having another, be having a Jinshin Jitsu as well topic. And like CST, like Craniosacral Therapy and Reiki and Jinshin, you have a lot of physical touch, right? So with Reiki, as you said, it's a conduit where, the universal energy life force goes through the person and they become like the funnel essentially for it to come out. With Jinshin, you're connecting the energy pathways of the body. And I guess the very difference here is that you're not necessarily doing either. You're just you're just almost like your hands are just sitting there as it basically to tell them, here's the location, this is where you want to focus on. And that's all you're kind of telling. You're just telling, right? Is that, am I getting this correct?
I'm just saying that, hey, I'm here.
Yeah,
this is where I am. This is where it needs attention. It's kind of like holding space for the body, but not really like pushing like, oh, you must heal here. This one needs 10 grams of calcium and 20 grams of iron, and like just come here. No, we are not demanding that of the body. Like if that's the priority of the body to devote more resources to heal, then that's where it will be. And that's pretty much what the whole I mean, that's my experience of it. And how it's so palatable to me, and it's so it's just so simple. Not a lot of like thinking I need to do. Not a lot of judging.
In the session as well, like besides just holding space for the person, what other, because you did some stuff with me where we talked about some stuff, so is that part of CST as well?
It's an extension of CST then. It's called somato emotional release.
Okay.
So
Let's talk about
somato,
that. Hmm.
somato is another like way to say somatic, which means body, and emotional is emotion. So we like I said, like the body trapped some emotions, and then it just kind of like gets stuck there, and over time it may blow up. Like for many people, like how PTSD can blow up like 20 years later. um, it can blow up like sorry, not you, but someone um, maybe started running down the street naked in that way, like a psychotic break, or it can blow up internally and then present itself as some kind of disease that is really different, really odd for someone who is healthy. Like I have a client who all don't smoke, don't drink, and she has like this um autoimmune disease that I cannot even pronounce. It's so long. And then it just your body attacking
Yeah.
itself.
Yeah.
And she's suffering so much. And then, like it's so hard for her to get pregnant. It's so hard for her to get on with her life. She needs a lot of support in that sense, because like then it drains the energy of her family members supporting her. It can get very emotional. So it's all like blowing up. And and when we explore, like her background and all that, there's a lot of childhood trauma. There's a lot of pressure from doing well. There's a lot of stress, even as a kid, as a
Hmm.
5-year-old kid, needing to be number one in ballet, number one in swimming, number one in kindergarten.
Yeah.
It all adds up over the years. And even, yeah, and so I can see like the progression of how actually all these conditions, it didn't just happen now. She said,
Hmm.
okay, it started in 2 years ago, but did it really started then, or did it just surface then?
Hmm.
So that's one of the way that I look at how um this whole somato emotional release is about. Like we during the session, as I dialogue, I trace that symptom or that root back to when it happened. And usually it's childhood. During our
Hmm.
formative years, we absorb a lot of things, we don't filter them, and then they get stuck. Maybe it's just a form of like I'm not good enough, which is very, very common.
Yep.
And then for some people, say for myself as a kid, um, I don't sleep well. So this was the thing that came up during the session with that lady, the one with the
Hmm.
pins and needles. So it was because I couldn't sleep well. I couldn't go into deep sleep. And it's not just because I have a baby, because people with babies, they sleep well for 4 hours and they wake up and then they feed, right? So, but for me, it's been a lifelong thing since young.
Hmm.
And turns out there were a lot of fighting in the house when I was young. And as a child, I have no idea what's going on. It makes me feel anxious. And I carried
Hmm.
that anxiety throughout my life.
Yeah.
And having my own baby, actually, in a way, it triggers this mechanism again, and it amplified it. So I'm feeling it more. Yeah, and so I struggled with like motherhood early on because of that connection as a child.
Hmm.
Yeah.
That's
That
really, really
uh,
interesting. Yeah, because I think I would really like to go more into this because I think so with the somatic emotional release, and I think that's a topic that I'd really like to cover because uh, when we're sitting in COVID times, forget even when we're even with childhood is obviously where a lot of these things were stemming from, and I think I don't really know where this thought is wanting to go, but it's wanting to go somewhere. Bear with me.
let's go.
Um, let's go there. But I think with a lot of people in COVID, right? Of course, we're all in this mode that we're like, we just have to kind of, get things going, just get things done. We don't really have time to sit in and mull over things because we're just being thrown, hand
Survival
grenade.
mode.
You're just
Mm,
thrown survival mode, right? Like hand grenades any other time just going at us, and we're just like, okay, dodge here, dodge there, and we'll
yeah.
we'll, we'll make it work because we've got no time to really process, because the moment we start processing, obviously I think fear starts to creep up, like when is this going to end, when is the semblance of a normal reality, whatever we were understood as a normal reality,
Yeah.
will come back. And I guess unknowingly many of us might be trapping a lot of anxiety and a lot of fear, and a lot of these suppressed, these negative emotions are going to get trapped somewhere in our body. And is there, I guess my question is there anything that we can do to prevent some of this, using some of, like, could we do a little bit of somatic emotional release already on our own, or CST on our own, or is it better to see someone to do it? Is there anything that we can do on our own already?
I feel most people are not like able to hold space for themselves. They are not able to sit with their feelings without being annoyed, frustrated, or angry at themselves. Like for someone, if you tell them, oh, let's just sit with your feelings, they'll be like, what is that? What does sit in, like, sit with your feelings?
Yes, exactly. And don't you think that starts from childhood? Because a lot of the times when we were kids, parents never really allowed us to express our feelings. If it was like we're crying, they automatically want us to stop crying. Stop crying, look away, that's enough. Oh, look at this, look at this. Yes, exactly. And that's a problem, because then, I mean, the feeling, like, you may have stopped the action, but the feeling hasn't gone away. And it's just gotten trapped. Yes, sorry, go on. Yes.
So we learn that our feelings are not important. Our feelings are secondary to our achievement in school, are secondary to the praises we get from parents, like the good jobs. And if they don't come, then it means that something is wrong with us.
Yes.
So something is wrong with our feelings. Yes. So many of us, especially for my clients, I have to kind of retrain them to be with their feelings, because end of the day, I mean, if you just think back as a child, wouldn't you want someone to acknowledge your feelings? Wouldn't you? Oh, so you're feeling sad. Okay. Yeah, you lost your toy, and it's natural to feel sad. I mean, come on, we lose our phone and we can have bad mood for like 3 days. What are we expecting our children to do?
Yeah. Forget losing your phone. Let's say your phone just died, right? No battery. Then you're like, where's the charger? I don't know where's the charger. I'm in the middle of nowhere. I should have charged it. Like, just from losing battery leh.
And we are adults. We're supposed to know how to handle, but we don't. And then here we are, we're expecting a child to be able to regulate his emotions. It's just so weird. And I have to learn to do it for myself. I used to ignore my feelings. I always suppress my emotions. That's how I was brought up, and that's how I learned to be functional. I always thought it's wrong for me to be emotional. And then as I got into this work, I realized, hey, being emotional, being sensitive, it's very helpful for me, because I know exactly why I'm feeling this way. And I just need to go inwards and go like, okay, Sharon, what's going on? So during COVID, I was very anxious. I think for the first 2 weeks, I was just so anxious. I cannot do anything. Occasionally crying because there's so much uncertainty. I fear for myself. I fear for my child. Like, what's going to happen? And then I just found time. Like, sometimes I tell my husband, I cannot do this. I need to hide in the room and then just do some breathing and just go inwards. Like, okay, Sharon, what's going on? Like, why are you so agitated? Why are you so frustrated? And why are you like lashing out on your child? And I realized because of all this fear and anxiety inside, there's no outlet, because I have no time to look inwards. And when I gave myself that time and just breathe and go like, okay, what am I feeling? Okay, I'm anxious. Okay, so what is this anxiety about? Oh, because of all this uncertainty. Okay. And is there anything I can do about this uncertainty? No, because it's outside of my control. Okay, so what is something I can do right now? And I'll go like, okay, maybe drink some water. I cannot get out the house, but maybe I can drink some like nourishing tea, like herbal tea, or like do something nice for myself. Like maybe spend half an hour in the bathroom doing body scrubs, some spa treatment. I usually spend like 10 minutes. But so how do I support myself in a way that I feel nourished, caring, loving, and give myself that first. Give myself permission to feel, to also fill up my cup. Before I sacrifice, I don't like to use sacrifice, but like before I pour from my cup, give love to someone else, to my family, to my friends. So that's one thing I do for myself. And I realize it's very difficult for many people. Like when I talk to my friends, they go like, hey, Sharon, I'm so anxious, this whole thing is making me so stressed out. Can you help me? And I go, okay, let's sit here with your feelings for a while, you know, just close your eyes and breathe and go like, I cannot feel anything. I cannot feel anything. I cannot feel anything. And then I have to force them in a way. I say, is it you cannot feel or you don't want to feel? And then that's when they go, actually I don't want to feel because it's scary. It's scary to feel sad. It's scary to feel fear. And it's because all of us we were not taught how to do that. And actually when we can go there, I realize a lot of them, they don't need a lot of time. Like you can be anxious the whole day, or you can sit there for like 15 minutes, 20 minutes, and sitting with that feeling for 20 minutes, it can feel like an eternity.
Yes.
In terms of time spent, you actually spend less time.
Yes.
Right?
Yes.
And after the anxiety moves through your body, maybe you cry, maybe you shake, maybe after that you felt very tired, you need a nap, and after that it's okay. So emotions is always, sometimes they call it like energy in motion, right? Like it needs to move, and once it moves through, then we release it. Like naturally we are able to release emotions that way. It's just that we have shut it down. We refuse to sit with it. We refuse to acknowledge it. That makes it so difficult.
Yeah. Is there something that, so then maybe we can give people, because obviously CST is better to do with a practitioner, right? So there's not much a CST that we can give as a takeaway for people listening or watching today's episode. Perhaps we could break down a very simple method of people sitting with their emotions, and then like could like, for example, what you did with me, could we give them something like that, you think, where
I'm open to do one with you now as a demo.
Okay.
You don't have, we don't have to go like deep. We just sense what our body is saying, and then we just breathe. So I would say it's more like a breathing exercise. There's no like digging of emotions or stories. We don't need that. We just sit with that anxiety, and then we just observe how it is, and then we just breathe. The breathing is important here.
Okay. So okay. I'll say okay 10 more times. So okay, all right. I will try not to, because you know me, I'll just go deep like straight away. So I don't want to scare anyone. Okay, Ken, ready.
Okay, let's just close your eyes and take a big, feel deep breath. And as you breathe in, observe where any of this anxiety might be located in your body. So for me, I'm sensing it in my chest.
I've got two locations. One is to the left side of my chest, and also the solar plexus.
Okay. And we are just going to continue breathing and observing. So for those in the audience who will be like, oh, what do you mean? Where is it in my body? If you cannot feel anything, it's okay. Right? We're just going to repeat, it's okay. So breathe and observe how your body is expanding or relaxing, or like, is there any tension in the body? And where there's tension, there might be that emotion, you know, the anxiety or fear. And I like to guide my clients with some imagery. So like, how would you describe that feeling you have in your left chest? Does it have a color?
Yeah, it's coming up as black.
And does it have a shape?
Yeah, it looks kind of like a splat, like as if you throw paint.
Like an ink block, okay.
Yeah, like
And
an ink block, yeah.
then would you say it's fluid, texture-wise?
It seems very static, so it's not really Sorry, is it the opposite of stagnant? Whatever, it's not moving.
Okay. And how big is it? Like out of 10, 10 being as big as you can imagine it.
The number 5 is coming up.
Okay. So we are going to, I mean, for simplicity's sake, I'm just going to focus on this one instead of the one at solar plexus. And just continue breathing and just observing this splat in front of you. The key here is no agenda. There's no need to fix this. It's not a problem. It's just something that showed up and we are just going to look at it like we watch TV. With curiosity, with no judgment. And as you breathe, sense again if there's any change in this left side of your chest. What's that?
It's getting lesser.
Okay. So where somato emotional release may come in is when we start dialoguing. So I wouldn't dialogue with you now, but you can do it on your own. Like, okay, what message do you have for me?
Yeah, so I did an internal dialogue. And I think just for audience sake, the dialogue doesn't have to be something that you actually hear, or if it feels like it's your imagination talking to you, then that's fine. That's totally okay, right? Yeah. So in my imaginary dialogue with the splat basically told me that I feel like it basically kind of said that, you know, you have this tendency to think that you need me to stay around to give you, like, not some sense of purpose, but some sort of like explanation for things. But I don't actually need to be around. So if if you're willing to let me go, then I'll go. And it doesn't mean that that you don't have an explanation anymore. You just don't need me to be around to be the explanation anymore. And so when that happened,
to let it go?
Yeah. So now it's sort of like it's a little bit more translucent. It's definitely a lot lighter. It's almost to the point of, sort of like when someone's disappearing, if you see it in movies, like parts of them have started disappearing. So some of it is faded.
Okay.
And a lot of it is lighter, and it's not really the shape is not really there anymore. So it's kind of gently going away.
Like fading, right? Okay. And so this is something we can do for ourselves as we breathe into that space, that tension that you may feel in your body. Have a dialogue. It may seem weird, like talking to yourself. Just go with it. Like children does it all the time, and it's not weird for them all the time. So just dialogue with yourself. The first thought that comes in is usually the best thought. That's the one that is true. That's the one that is real. Even though you feel like, oh, am I imagining it? And then you started like analyzing it, then it becomes unreal. So you go with it, and then you breathe some more, and you observe some more, and see if it changes. Because this is the message that this part of the body wants to tell us. And as we learn to do this more and more, we learn to access our body's wisdom, and we can start to learn to feel safe in our body. And that's when we can learn to be resilient, like in times of uncertainty, in times of doubt. We know that no matter what is happening outside, our body is the sanctuary for us. We can feel safe inside. because we are so adaptable, we are so resourceful, and we need to learn to lean into ourselves, into our inner wisdom. How's that? What splat?
Well, it's kind of gone.
Okay. How's this for a demo?
It's a good demo. And then people, if you're still closing your eyes, you can open them up whenever you're ready. But yes, okay. I'm gonna open them up if that's okay.
Yeah.
Yeah,
Once it's
no.
gone, it's gone.
Yeah, once it's gone, it's gone. And I think that's the other thing is that your body's actually really intelligent. People just sort of think about the body as just this shell that we just move and operate in the world with, and it's really just the brain that's the more important thing and the most intelligent part of the body. But actually, your entire body works together. The brain works with the body, and the body works with the brain. Each one basically keeps the other alive. So it's not separate things. Obviously, as human beings, we've had to dissect things because it's easier to then understand things in parts. But it doesn't mean that just because we've understood them in parts that they don't actually work together as a whole. So yeah, your body's super intelligent. That feels like it's just like air now. It's so interesting. I'm getting a little bit of like, I don't know. It's like little energy. It's like your pins and needles, but it's not pins and needles for me. It's like floaty
Buzzing?
energy dancing.
Okay.
Yeah, dancing energy. So so that's the kind of sensation that I got when I did the session with you. For example, I just felt like my entire lower section of the body, from like the rib cage down, basically was just as if there was just air. Like floating air. Like I didn't feel the density of my body anymore, and that was really interesting, that how that was releasing all of that. And that's the other thing, like if you think about it, people who are listening and watching, is that when you think of happy energy, like you tend to feel lighter, and obviously when you have negative energies you will feel denser and you will feel heavier, because that is the frequencies of those energies. So it sounds all woo-woo, and it also sounds a bit like I don't know what this means and I don't know how to deal with it, and that's fine. You just take your time with it, and go see people like Sharon who can guide you a lot better into it and help you release some bigger stuff if you think that you need to release some bigger stuff. Because the body, whether it's autoimmune or chronic pain or things that we're born with, a lot of these things are, I think, well, it's coming up a lot more in research, which is hard to research these kind of things as well, because it's very difficult to pinpoint it medically in the 3D. But a lot of it is coming from subconscious belief patterning, and it's coming from things that we were exposed to that we may not have conscious memory of, and it just gets stored there in the body as energy and denseness, and then manifests into something physical. So if any of you out there are looking into it, I really, really highly recommend seeing Sharon. I think in terms of just like a final a final wrap up question, for example, maybe to say, it's just like, what's the shift that you want to create in the world? I can't get words now out because I'm just so like, wee. What is the shift that you want to create in the world with your work, Sharon?
Well, because of my journey, I feel more passionate in helping women find their voices, and be empowered to make an impact in the world. Many of us, actually, we want to do that, but we just believe that we cannot, believe that we have no ability to, but actually we can. And I see myself as a guide on the side to help empower these women to become even better, to thrive, to get past their inner demons, and make the whole world a more nurturing, more loving, more caring, and a kinder place. That's my wish.
Wonderful. All right. Well, on that wonderful, wonderful note, thank you so much for joining us on Shift with Shubhra. And thank you everyone for tuning in, and we'll see you soon.
Thank you. Bye.